If you come to the surgery, it may seem quite empty at the moment, but in fact most of the doctors and nurses are here consulting either on the phone, and we are seeing some patients face to face and asking those patients in general to wait in their cars in the car park and being called through. That way there's very little contact. Why is this pandemic so much worse than other pandemics we've heard about over the last 20 years or so with swine flu or bird flu? There's a few reasons, but those were both influenza viruses, and with the influenza or flu virus we have a lot more scientific data, and of course vaccines. As you know, every year the flu vaccine is updated, and we don't have a vaccine for the coronavirus, and possibly we'll have one, but it might take 12 or even 18 months, but that's by no means certain. And so during this time when we haven't got a vaccine, we need to employ these quite stringent public health methods that we're using in the lockdown over the past couple of months, to great effect, I might say. But one of the other big differences with flu to the coronavirus is its infectivity. We think about perhaps 3 people could be infected from one case. And one of the reasons for that is we get many asymptomatic carriers who don't know they've got the disease at all, may pass it on to others. And also it's thought that the coronavirus is infective before you get the symptoms. So it seems to spread in the communities, as we've seen in Guernsey and to a greater extent around the world. The other unfortunate big difference is the death rate with this coronavirus is much higher than the flu, and particularly in the elderly. And that's the reason why public health and Guernsey in general had to act so stringently to get the numbers down. We think probably there will be other waves of this, and the reason for that is if you look at the historic data from Guernsey from 100 years ago for the Spanish flu. The first wave occurred in the summer then, and it was quite small, and then in the autumn and winter time there was a larger wave. And the reason for that is manyfold. One, during the summer months where we are now, we can do our socialising outside, but of course in the autumn and winter socialising tends to be in the indoors. And if we didn't have our public health measures, it's inevitable that the numbers would go up for that reason. How can we stop ourselves getting a second wave? Well, we've got a bit more science on our side now than we did 100 years ago. And as you know, public health have been asking anyone with any possible symptoms of coronavirus to get themselves swabbed for the virus. We can get this in 2 ways. If you feel quite sick, then you could phone the Queen's Road surgery and we'd arrange to see you at the Chest and Heart Clinic, which is separate but in the hospital grounds. And there it's all set up to examine in a safe way and to do the swab, which is a nasal and a throat swab. If you didn't feel so bad and didn't think you need to see a doctor, then you can phone up the public health number, which is available on gov.gg. And public health would arrange for you to go down to the port where the swab is done, actually while you're sitting in the car. Either way, the results will come back to you via public health. So what are the symptoms? Well, at their mildest, there might be a runny nose, sore throat, feeling achy and being tired. But as it progresses, it can develop into high fevers, a cough and shortness of breath. Of course, if you've got some of the more severe symptoms, you must be seen by a doctor and checked out.